All right, let's get started. So the good news about low back pain, this is a topic that I'm really excited about and is really relevant for me. So I'm excited to kind of share some of the information that I've learned about low back pain in athletes. Just a quick introduction. My name is Kelly Bruno. I'm a board-certified anesthesiologist, also currently doing additional training in interventional pain medicine. So this topic is particularly relevant to what I do every day, which is see a lot of patients with low back pain. But I think it's also relevant for me because I have I've engaged in sports for a long time. I've been an athlete for a good portion of my life and have experience in both strength and endurance sports. So again, this topic really resonates with my personal background, and being able to talk to athletes about the risks of low back pain and also the, and ways to prevent it, but also the good news about the progression of back pain and that it does not need to be, life-limiting. Whether you're a recreational athlete, you're an elite level athlete, or you're just sedentary, you are at risk of low back pain at some point in your life. So this could be due to working conditions, types of exercises that you do, muscular imbalances, age, or a history of trauma. They all put you at a higher or lower risk of developing low back pain. And so I think it's really important to keep this in mind as we work our way through this little talk, but also just when you engage in different activities in your life. So to start with the bad news, let's look at the numbers. Unfortunately, low back pain is very common. So it's the second most common reason for individuals to schedule a visit with their doctor, with a primary care physician. And this is in the general population. This is not limited to just athletes. It affects up to 84% of the general population. There's a wide range, so 51 to 84%, depending on the study that you look at. Very broad range, but even the lowest estimates are still greater than 50% in the general population. That's not just looking at athletes. And unfortunately, if you've had low back pain at some point in your life, then you are more likely to have it again. So something to keep in mind. When you look specifically at athletes, the numbers are a little bit better, also a little bit different. So wide range in report of back pain, 1 to 40%, again, depending on the study. This, I think, really is, the large variation is due to the types of sports that individuals are engaging in. So depending on the type of sport, you may have a higher or lower risk, and that's something we'll get into on the next slide here. But certain sports do present and do have a higher rate and a higher prevalence of low back pain, specifically sports like gymnastics, diving, golf, rowing, movements that really put a lot of stress on the spine, a lot of compression on the spine, especially asymmetrical compression. Something, again, to keep in mind. Importantly, of all sports injuries, low back injuries make up about 10 to 15%, which I actually see as kind of reassuring, and it makes me actually, there are a lot of other types of injuries that people will have first. All right, so what do we know specifically about low back pain in athletes? This representation is from a study in elite German athletes. They looked at about 1,200 athletes and compared them to physically active controls. I think looking at this type of chart really shows that there's a huge variation depending on the type of sport. The risk profile is really dependent on the type of activity. Again, sports like gymnastics, even dancing, diving, rowing, all have higher correlation with low back pain. Interestingly, and I think really notably, sports like triathlon actually have lower prevalence. So the odds ratio for low back pain in elite level triathletes is actually lower than physically active controls. So these are high level, very competitive athletes that are engaging at high levels of competition, and they actually present with lower risk of low back pain. So I think that is huge, and that's something, for people who may have low back pain at some point in their life, and they're really concerned about engaging back in sports and being athletic again, or just being, recreationally active. There are certain types of activities that may be better, and they still allow you to really gain the benefits of being physically active, the cardiovascular adaptations, even the muscular adaptations, and even the weight loss benefits, just from a higher level of physical activity, and still puts you at lower risk of developing back pain over your kind of less active counterpart. Other sports, not from this study specifically, but from other studies that I looked at, actually found that weightlifting can also put you at lower risk. So they looked at weightlifters compared to, again, physically active controls, and found that the weightlifting and athletes who engaged in high-level weightlifting had lower rates of low back pain, and interestingly also had a higher tolerance for pain, which probably isn't too surprising. And then running and cycling actually correlated with beneficial effects for the intravertebral disc and spinal muscular adaptations. So we'll get into that more kind of in the future in another talk, but definitely something that is really important when you're looking at ways to protect the spine. Certain engaging in certain activities, again, road cycling and running, actually have shown to be beneficial for the spinal adaptations. One of the other kind of interesting points that this study really focused on is this idea that the rate of back pain was related to the total training volume. So it does seem like there's at least a correlational effect. That doesn't mean that it's dependent, I suppose, on the training volume itself, but there was a correlation between the total training volume and the rate of back pain. And again, the other thing that was definitely notable is these extremes in flexion and extension of the spine certainly put it at higher risk. And if you look at the Nikimson review on the load, the pressure within the intervertebral disc when various types of forces, whether you're standing with weight, whether you're leaning forward with weight, whether you're sitting with weight, the effect of that on the pressure within the disc, it's really significant. Again, something that I'll probably talk about in the future because I think it's really, really interesting. But you can see how these extremes in flexion extension can put more pressure on one part of the disc and result in kind of this slowly progressive degeneration. And so again, really important when looking at types of sports and rates of low back pain. All right, so the good news, one other thing that I just wanted to comment on is the fact that one thing that's often noted is higher rates of degenerative changes on imaging. So if you got an MRI of a high-level athlete, you actually will likely see higher rates of degeneration in that individual than a less active or just a sedentary control. But the good news with that is that these radiologic changes don't appear to correlate with higher rates of back pain. So a lot of times we'll see changes on imaging and the person has no pain at all. Sometimes we see no changes on imaging and the person has pain, and so imaging is not really the be-all end-all of diagnosing back pain. It's gives information, it provides information, but needs to be really taken in context. All right, back to this idea of, or this correlation between activity and back pain. This is from another study that kind of proposed this idea of the optimal dose effect and explored this relationship between the amount or the total number of training hours and the kind of the odds ratio or the rate of developing low back pain. They did consider some other things like the type of activity, the intensity of the activity, and then the exertion, so how much stress was put on the back. But a big part of it was this time spent on the activity and looking at the rates of chronic low back pain, so more than 3 months duration. And they did find that both extremes of the physical activity are associated with a higher prevalence of chronic low back pain complaints, suggesting that the relation between the level of activity and the chronic low back pain appears to be this U-shaped curve, so too much or too little is equally hazardous for spinal health. So you really finding that point in the middle where you can be physically active but not essentially overdo it and put yourself at higher risk of developing chronic low back pain. Unfortunately, one thing that really was not explored is the specific number of hours or the amount of time. So that I can't really comment on, but this idea that somewhere in the middle there is a good optimal dose of physical activity that you benefit from without putting yourself at higher risk of back pain. And so I think this needs to be explored further, certainly to identify, are there specific hours or does it depend on the activity that you're engaged in? But I think it does continue to really support the idea that physical activity is good for the low back. Some of the common causes of low back pain, I'm not going to go into this in detail at all, but just wanted to comment on the fact that there are a number of different reasons that you may have back pain, and even some of the pain that people present with can actually be from the hips. Although it really feels like back pain, it can actually come from that joint where the between the essentially the spine and where the hips meet. So these are all things certainly that I think about when I see patients who come in with back pain. The most common are going to be sprains and strains. Certainly that accounts for the highest number of presentations of acute back pain. So this is stretching or tearing of ligaments or tendons and muscles in the back. And lots of different reasons this can happen. Certainly can be extremely painful, but does improve, does get better. So I think that's the big takeaway. It does get better. How does it get better? A big part of that is time, staying kind of mobile and active, but not overdoing it. So really kind of dialing back on the amount of stress that you're putting on the back, but trying to really stay active and keep those muscles moving. NSAIDs have also been shown to help with that type of pain, just reducing that inflammatory response that occurs when you kind of have this trigger of these spasms within the back muscles. Some of the other ones, intervertebral disc degeneration and herniated discs, obviously very concerning. Patients that present with radiculopathy, or that pain that goes down the leg to the foot, that kind of pain, obviously very concerning when people develop that. Again, the good news with that, especially herniated or ruptured discs, those do get better too. It may be, it doesn't happen overnight. This is not something that just like improves immediately, but if you give it time, 3 months, 6 months, 9 months, it does get better. It's something that I treat a lot in the clinic and with procedures. Interestingly, the procedures that we do, I think people do feel better, but oftentimes we do tell patients it probably will get better on its own without us doing anything at all. The best things for that kind of pain, physical therapy, really to strengthen some of the muscles in the area, take the load off of the spine, and then again, NSAIDs. That's what the data shows, and I've seen it with many patients. All right, so just to kind of sum up the good news about back pain, I think it's really important that to realize that most back pain will get better. There are only a small number of individuals that will go on to develop chronic low back pain. So 8%. It is, it's not insignificant, certainly, especially with the number of people that develop back pain at some point in their life. But I think if you do all of the right things, if you really take it seriously, when if you say quote unquote throw out your back, if you really take it, take the time off that you need to really recover, either do spinal manipulation, physical therapy, NSAIDs, stay active, but don't continue to stress the back, it does get better. So again, the most common cause is going to be lumbar sprains and strains, self-limited, and responds well to conservative treatment. So NSAIDs, aspirin, Tylenol, osteopathic or spinal manipulation, physical therapy. It does get better. There's also some data that's coming out, very interesting in the literature, that dynamic axial loading of the spine at slow to moderate movement speeds is likely to result in positive adaptation. So anabolic effects on the intervertebral disc, really important. The literature also indicates that running and upright endurance sports are either beneficial or at least not detrimental to the health of the intervertebral discs in the spine. That, to me, says a lot. So running, I'm just going to repeat that, running and upright endurance sports are either beneficial or at least not detrimental to the low back. So kind of building some of those types of activities into your physical activity can be really protective. And then, again, important, reduced physical activity and disuse appear to be detrimental for the intervertebral disc. So I think another reason to stay active, even if you develop pain, stay active. It can actually be beneficial. And then most patients improve with non-operative treatment, so people get better. Just some of the references that I have used, and so you're welcome to go check those out. And I just want to say thank you for listening. Certainly, follow either my posts. I hope to do more of these. I think these are, it's really important to educate just from the experience that I've had and the literature that I've looked at. And yeah, thank you.